Let's go.
Hello, everybody. Good morning and welcome back to the show. And today we are honored and very happy to welcome visionary leader in the social healthcare, Dr. Sona Sharma, promoting wellness not just in the hospital but also in the houses, in communities, and in digital spaces where we live in every day. Her work continues to inspire countless lives, individuals to take charge of their lives, their health, and digital well-being with awareness and purpose. We are delighted to have you on the show, ma'am, with us today. If you would just walk us through your journey, so at
Hello.
least the audience can get acquainted with you and your next on the screen, please.
Sure. First of all, thank you for inviting me. It's wonderful to be on this podcast. Your previous episodes also were very interesting. So I'm glad to be here. Nothing much. I mean, my journey in the past few years has evolved from being what I was earlier to being an author. And an author, I think I became out of a serious twist of fate because it was not a planned journey. And uh, I've written around 4 books, but the one that I'm going to talk about today is Mandeep Meets Mandeep. It's my fourth and the latest book, and this is very close to my heart. And I shifted to Punjab recently, and the situation in Punjab, I realized the cancer situation was pretty bad. When you're outside, you don't realize the seriousness of it. You just read some news articles and stuff. And that inspired me to write this book. And over the last 2 years, the whole trajectory has changed. And I'm seriously, advocating two things. One is the preventive aspect, and one is the curative aspect for the situation here through my book and through my talks. So that's what I'm doing right now. Apart from my health concept called Health Track and an initiative called Screen Out, which is focused on digital well-being. We see kids getting hooked to screens, and they're spending 8 to 10 hours daily on screens, and it's taking a toll. I'm sure everybody realizes how bad it is. So that's the other thing that's going on. So all this about me.
Thank you so much for this precise introduction. Actually, I am very keen to know about the cancer initiative you have been working on in Punjab, specifically, because it's a very important topic. But let me just start with the stem cell donation. That is again, a very important contribution that you're making in your field. So your advocacy for blood stem cell donations has inspired many people around you, and then they're motivated many people around you in the same direction. So how do you think that people can get involved? So what is your basic idea and the initiative that you can be taking for involving people so far?
So India has an alarming situation. It's the third in the world in the count of reported blood cancers. So I'm talking about reported cases. So every year we add around 70 to 80,000 cases. So it's a huge burden, and around 70,000 deaths a year. And just not this, there are other blood dyscrasias where stem cells transplants can help. Like thalassemia, that's also a big issue in India. So what started out, it's a very interesting story. In fact, one day I was just reading the newspaper with my morning tea, and I saw a headline which said, Mandeep saved Mandeep. It was just a headline, and that sort of piqued my interest. And I read the article. I had recently shifted to Punjab, and it was about a farmer, a student farmer in Punjab, who had battled CML, which is a blood cancer, for more than a decade. And then he was able to get a stem cell transplant from his namesake, who was another Mandeep. And this other Mandeep was from Bangalore, and he was an IT professional. So here's a farmer in Punjab, and there is a an IT professional in Bangalore, and they shared this unique bond. They turned out to be genetic matches, and after a lot of search, this donor was found. And so, it was a very successful transplant, and today both Mandeeps are doing well. And somehow this headline, it stayed with me, and it inspired me to find out. I just wanted to know what happened, because the topic was interesting. So the author in me was sort of interested, and I got in touch with people who wrote the article. And one thing sort of led to another. And within a few weeks, I was speaking to both of them and the people who had facilitated the transplant. There's an organization. So I was speaking to all of them, and then the story just happened, and within a year this book was out. So it's called Mandeep Meets Mandeep. And through this book, I think I also did not know how it would go, but through the book, I was able to motivate a lot of people to speak about the issue, and to sign up as blood stem cell donors. So it's not like any blood donation or anything where you have to just match the uh, blood group. So here you need to have a DNA match. So it's not very easy. It's like finding a needle in a haystack. But it does offer a very, very high level of success in curing. I mean, it's not curing, but you are able to get rid of the cancers. Even in thalassemia, it is used extensively. So in India, if you look at figures, we need around a lakh of transplants a year, around 1 lakh, but we
Very
only managed to do around a couple of thousands, 2000 versus 1 lakh. So there's a huge gap, and this gap is because of multiple things. One, there's a lack of awareness. Not many people know that you can register as a donor and save a life. So there's a huge lack of awareness. Two, it's an expensive process. And three, not everybody is able to go in for not everybody these challenges. So the moment we have a higher number of donors signing up, the possibility of getting a donor and going for the process, etc., becomes much easier. So, so the book actually led to a lot of conversation in my circles, the authors, my friends, and everybody pitched in and spoke about it. In fact, the book has a QR code at the back through which you can register. And you can find out more about the process and how you can sign up as a donor. So the book, even the bookmark has a thing. You can register as a donor. So this led to a lot of conversation. Some of my acquaintances signed up. Some unknown people also signed up. Some people called me for financial support. And I guided them to the right NGOs. In fact, Mandeep himself held a camp in his village, and we both managed to educate and recruit register over 100 donors at in a single village. So the impact can be immense, and anybody who talks about it takes it one step ahead. So that was the whole purpose behind this whole advocacy thing. So I'm continuing to do whatever education I can do from my end, and I'm so thankful for people like you who support the causes by inviting me to speak. So that's also really great work.
Well, it is actually a pleasure to have you on the show from our side, and I'm glad I came across this because this is actually a very noble cause. I think this should be brought to the public notice anyhow. Because I mean, I can totally understand from the factual information that yes, there are very increasing cases of cancer and other issues. So in case any initiative we could do from our side, which could reduce the risk and save the lives, I guess there's nothing beyond and better than that. So of course, and then even the story is almost like I mean, very, I mean, magical story or what? It's a coincidence. Somebody with the same name and try also
Yeah.
matching your stem cells, and then try helping you save your life. So it's
Yeah.
again by God's grace, and so I mean it's very
Yes, yes.
amusing. Yeah, I'm really amused to see this kind of incidents happening, and the contribution you have been making through your book. So it's a commendable job you have been doing, doctor. So okay. So personally, I actually want to know about you in detail. So as a doctor and as an author, how do you bridge the gap between the science and the storytelling?
I've been asked this question many times. I was in for this book specifically. I tried to be more objective and more, careful with my words and the way I wrote the story, because I didn't want it to be a boring scientific, medical, non-fiction which people would not enjoy. The story itself is so thrilling that I'll tell you about that, but let me finish this answer first. The story is of two people, and I wanted it to be of two people and not filled with medical jargon and stuff like that, because the connect that people can have with people is far more than what any kind of information led content can do. So which is why I deliberately kept the flow and the content more about the incidents and the people and the work that went on behind the scenes, and captured the essence of everything. In fact, a lot of the content is exact words spoken by people. During my interviews, I interviewed around 20 to 25 people who are actually characters in the book, and I've tried to keep a lot of it verbatim so that the authenticity is. So I did try to uh, give the information that's required, but simplified it to a great extent so that it could connect with the reader in a different way and not be a boring jargon-led non-fiction.
I actually could understand the concern behind writing. I mean, looking at this perspective towards writing a book, because it's very true. People don't prefer to read unless until they have an interest, and or even if they want to have some medical information, they would start with it, but they won't continue till the end. So it's very important
Yeah.
to be very much concerned about the readers when we are write some books. So again, the thought is actually it actually makes sense in the right way,
Yeah.
and especially when you're supposed to even compile a medical thought process behind a story that you're supposed to from a real life incident. So yeah, it's kind of not easy, I would say,
Yeah.
because we have been writing books. I understand how
Yeah.
difficult it is to just curate your thought process in the same place and then write the entire book, of course. So yeah. So finally, about your vision for the future when it is confined to healthcare and the social impact in the digital age. So what is your outlook towards the same?
So, digital age is here to stay, and I believe that it can be a wonderful tool, you know, that humankind can use. So everything from, remote surgeries to remote consultation and everything, that's going to add value to healthcare. The while in India, we don't overall have a shortage of healthcare professionals, but there are pockets, the far out areas where uh, um, uh, healthcare is not as well developed. So you have a primary healthcare setup, but not a secondary or tertiary. So I think technology is here to stay. Digital health is here to stay. And in fact, it's getting more and more evolved as we speak. AI is making a huge difference in the world. So, you even have, I've heard kiosks where you can do some self-diagnosis. But I think digital healthcare is here to stay, and it's going to make revolutionize healthcare, especially in a country like ours.
So any feedback, any advice that you would like to give to our audience from the area of your specialization, spreading a word?
Uh, yeah, so I think the two causes that I'm close to, I don't know if I can share the preventive aspect of the cancer situation in Punjab at this point. I think I would want to speak about it because
Yeah, I mean, of course, please go ahead.
apart
It's
from
very
the
important.
curative aspect where we Yeah, where we speak about the stem cell transplant, etc., there is a huge preventive aspect that we don't, normally speak about that much, and we take it for granted. When I came here and when I spoke to Mandeep, I went to his village to see what's happening and how everything shaped up, and that was actually the turning point when my book became turned, from a story of just two people, Mandeep saving Mandeep, it turned into a completely different thing, where so many things got involved, and I almost became a detective and did a lot of research. I ended up doing, visiting various places, going in, speaking to experts, and doing a lot of my own personal research,
Mhm.
because the village that he hails from, it's called Guyana. And if you just Google Guyana in Bhatinda, you will realize that this is the village that was in the 90s and early 2000s notorious for the sheer number of cancer cases. Every house had one or multiple cases of different kinds of cancers. The situation today is also equally, I mean, to an extent it has improved, but you still you will find every person knows somebody or the other who has cancer, their neighbors, relatives, and stuff. So it's almost like they have taken it for granted कि ये तो होगा. Why? So after visiting there, I saw that there were three main reasons. The first reason, after a lot of research in the 90s and early 2000s, since there were so many cases coming up, a lot of experts visited that particular village to see what's happening. And there were three culprits which came out. One, and the most serious at that point of time, was that their groundwater had huge quantities of uranium. Uranium, as you know, is radioactive. Okay, and it had extremely high uranium content. Plus, there were other arsenic and zinc and everything else, lead. So the water was extremely bad. Even today, 80% of groundwater is not fit for drinking in that whole Malwa area, because you still find all these contaminants plus other contaminants which I'll tell you about. So this whole uranium thing went out of proportion. A lot of research happened after that, and it seems like it is a ground, it's an impurity in their ground, in the granite stone which is under the top soil. So it's a geological cause, but nobody knew at that point कि ये क्या हो रहा है. There were just cases and cases, and the research brought out this uranium thing, and after that people stopped drinking groundwater. So then they had this whole canal system to supply better, potable water to that whole area. So that was the first one. The second one is that the soil itself is highly and hugely contaminated with farming chemicals. So as you know, Punjab is a farming community. You have a huge, everybody depends on farming. So the sheer amount of fertilizers, pesticides, and other chemicals that are used is contaminating the groundwater as well as the soil. And people, they have to be educated about how much they need to use and how they
Yeah.
need to use,
Mhm.
which pesticides are better to use. So this is a huge gap in terms of the preventive aspect. All you need to do for that uranium thing is to RO the water. Once you use an RO filter, the water becomes better. I mean, you can totally prevent that whole uranium bit. The pesticides and fertilizer led pollution, that is also preventable, right? And the third is there were thermal power plants, and even now there is a refinery which is always 24 by 7 spewing air pollutants. So for them in that village, it was a triad of all the three. So it's not just one factor which is, you can sort of say, okay, so it is three factors, and all of them multiply to give you that toxic situation, land pollution, water pollution, air pollution, everything is there. So that is something that people can tackle on their own, and all of these are preventive, are preventable. So I think we should not take all this pollution for granted, because that's what is giving us this whole problem. And in fact, at that point of time, there was a train called the cancer train, which ferried patients every day to Rajasthan, because that was where the nearest cancer institute was. So if you Google all this, you will see how, it gets really murky, and I really literally went into a rabbit hole of discovery when I went to his village, and that's what took the book to another level. So I also want to talk about this preventive aspect, which we don't really focus on that much. So Punjab has 16 to 20% higher than national average of cancer incidence, and and this Malwa belt, the Malwa region where Mandeep hails from, is the worst affected. So I think more conversation should happen on the preventive aspects of cancer, also cancer plus the other issues. So this is about my message. I think uh, uh, conversation like this, while people are talking, I mean, nowadays people are also talking about the smog thing and all the other pollution that's happening. But there are things that you can do. But the farmers need to be educated for how much pesticide. I mean, that's entirely in their hands. But we need people who can talk about the practical aspects of handling farming chemicals.
Yeah, doctor, I'm glad you're bringing this to the table actually, because this is, to my surprise, that we knew. I mean, we knew that cancer happens because of the your lifestyle habits that you pertain for yourself, and so though there can be other causes also resulting into cancer, but this is something which is not in your hands. It's not in your hands completely. So I don't know how people would be surviving trying to just hold it on. And second thing is that
Yeah.
I myself have stayed in Punjab. I've stayed in Punjab for about like 1 year. But I mean, we
Okay.
could not actually come into this. I mean, we had no idea completely. Though I could realize that, yeah, the water is not as good as it should be. So there were like, a lot of issues happening because of the water. But this could be the basic reason behind it, because I personally was using bottled water, even for having bath, and even for drinking. I used to
Okay.
use bottled water specifically, but I somewhere realized there was
So the
some
canal
issue.
water is good, because steps were taken to, once this uranium thing happened, a lot of steps were taken to ensure that people get better water. So the canal water was made available. But without education, people would still depend on their groundwater, no? Well water, and this is something that people need to be educated about, and consistently being reminded of.
Yeah, this needs to be talked about more. So maybe, in case you have some time in the future, we'll actually have a separate podcast specifically focusing on this in detail, going on the preventative measures. So at least we could have, we could spread
Sure.
the awareness for a social cause. So thank you so much for being with us on the
Yeah.
show, and I really enjoyed, and I really appreciate the conversation you're bringing on the table. And then it was again my pleasure to have you, because this even I wasn't aware of really, and
Same here, same here. It
so
was wonderful.
so it was nice to meet you. It was good to at least know about your book also. The way you have been contributing is really commendable. And I really thank you. I'm looking forward to seeing you continued with your work to inspire change and to also touch other people's life. And of course, we're going to have you in the next podcast where we'll actually focus upon cancer and how this could be prevented in the upcoming future whenever you're available. So thank you so much for being with us.
Sure. Thank you
Have a
then.
good day. Yeah. Thank you so much.
Same to you. Thank you so much. Bye bye.
Bye. Take care. All right, so this was with us Dr. Sona Sharma. Thank you so much for sharing your wisdom, your journey, your insights, and passion with us today. And your commitment towards healthcare is very compassionate, I would say, accessible, and especially making efforts, mindful efforts to try and maintain the spirit of social impact in the modern age. Trying to spare so much of time going for your research and then bringing such a different shift in the society through your book. Also trying to bring the story up, also trying to look at a very important topic of concern, which is cancer, and then talking about the causes and the preventive measures in short on the podcast today. I hope this would throw a lot of light on the need of being talked about this, especially when it's concerned to reducing the number of cancer patients in the country. So maybe we are looking forward to have you in the next podcast upcoming with us to have a detailed discussion on the same and doing our own initiative, doing our own part in terms of contributing towards social welfare and social well-being. So I hope anybody who comes across this podcast will be fascinated to know about it in much in detail, and they'll actually appreciate your efforts towards it, because we need to talk more about this very important topic, which is not easy and sometimes not even affordable for taking proper care of a patient in the family. So it's not even easy to fight cancer and to win cancer. It's not even easy to fight cancer personally in anybody's life. Uh, so let's just talk about it. We should actually be trying to raise the word and talk about it, focus much on this kind of concerns, so at least people are much aware around us. They're more literate and educated about these topics in the future, so at least they can prevent any kind of issues or health issues coming into their lives. So thank you once again. I'll see you next time with a fresh guest on the channel. Same time, same place. Until then, take care of yourself, stay healthy, and keep shining. All the best. Have a good day. I hope you like the podcast, and do not forget to subscribe, like, and share. I'll see you next time. And this is your host signing off.